The goal of surgery is to accomplish three main objectives. Reduction, which restores the spine back to its natural alignment. Decompression is the removal of damaged disc material or bone spurs that are pressing on the nerve roots and/or spinal cord. Stability, which is the stabilizing of the spine segments, usually through fusion, which eliminates unwanted motion. All three help in eliminating the symptoms described earlier. Charles was at first reluctant to have surgery, but remembers what life was like before his injury and wanted to get back to a normal way of life. He was confident that his doctor had thoroughly explored every avenue of diagnosis and treatment.
Anytime you hear the word surgery, you get nervous. But after I had spoken with my doctor, I realized that it was the best way for me to get my life back on track.
Like Charles, you have reached the point where your surgeon has recommended that surgery may be the best option in treating your cervical problem. Please remember to always follow specific instructions given to you by your surgeon and the hospital prior to your surgical procedure. The following are some of what you may expect. You will be instructed by your surgeon concerning any alterations in your routine medications, if any, prior to surgery. Discontinue all nicotine products because nicotine may slow down the healing process. Limit your vitamin intake to a multivitamin, although you may take extra vitamin C. Eliminating alcohol consumption is also recommended to avoid surgical complications. Please remember, with any surgical procedure, complications may occur. These complications may include pain, weakness, numbness, advanced degeneration above and below the operative level, paralysis, loss of bowel and bladder control and sexual function, stroke, death, anesthetic risks, blood clots, swallowing and speech difficulties, damage to your trachea, esophagus, and/or carotid artery, broken plates and screws, and a failed fusion. If you choose to have donated bone, you risk the chance of contracting AIDS or hepatitis. If you use your own pelvis bone, there is a risk of infection, fracture at graft site, hematoma, numbness of the legs, and chronic pain at the graft site. Some of these risks may lead to the need for additional surgery. This list is not all-inclusive, and, as with any aspect of your surgery, any questions you may have about these complications should be fully discussed with your surgeon before your consent for surgery is given. Earlier, we highlighted the basic indications for surgery on the cervical spine. Now, we would like to show you briefly what your surgeon will accomplish during surgery. Your surgeon can approach the cervical spine by two different methods. The first approach is from the front of the neck. This is called an anterior approach. Your surgeon will make a small incision along the front of your neck to access your cervical spine. This procedure is a very common and safe way to remove part or all of the affected disc or bone spurs, which will relieve pressure on the nerve roots and/or spinal cord. Once the disc is removed, your surgeon may perform a fusion of two or more of the cervical vertebral bodies in your neck to stabilize the area. This is the procedure commonly called an ACDF. In a fusion, the disc is replaced with bone from either your pelvis or donor bone from a bone bank. Plates and screws may be used to add further stability to the region. This will allow the two cervical vertebral bodies to fuse together and form a solid and stable spine segment. In some cases, the entire vertebral body and disc are removed and replaced with a bone graft to relieve pressure on the spinal cord. This is called a corpectomy. Plates and screws may also be used in this procedure to further enhance stability. For some patients, the surgeon may decide that a posterior approach is the best way to accomplish the surgical goals. In the posterior approach, the surgeon enters from the back of the neck rather than from the front. The surgeon may perform a cervical laminectomy, which removes part of the bony covering of the posterior cervical spine. This type of decompression creates more room for the spinal cord. Stability can also be achieved posteriorly by fusion, using bone graft, plates, and screws. In other cases, the patient may have a combination of both anterior procedure and a posterior procedure, sometimes on the same day, or staged a few days apart. Once the procedure is completed, and after you leave the hospital, much of the success of your recovery relies on your commitment to follow your surgeon's post-operative instructions, which may include the following. Take care of wounds by keeping the area clean and applying ointment once or twice a day to help prevent infection. If your wounds develop redness or drainage, inform your surgeon's office. If you develop a high fever in the first few days after surgery, be sure to call the surgeon's office. If you have any increase in pain, numbness, weakening, or neck swelling, or shortness of breath, call your surgeon's office immediately. If any emergency condition develops, dial 911 on the telephone or go to your local hospital's emergency room. Avoid swimming or bathing for at least 4 weeks after surgery. Wear the cervical brace or collar you have been given as instructed. You may shower 4 to 7 days after the procedure with your brace or collar on. Please remember to avoid all nicotine products and to take all medications prescribed to you by your surgeon. These are small investments to make a full and successful recovery. Just remember that this is a team effort, and your part is just as important to your recovery as your surgeon's. Also, remember that a positive attitude will enhance your results. Please follow your surgeon's instructions carefully and be sure to call his or her office if you have any questions.
I finally feel like I can get back to my normal life. No one should have to live with that kind of discomfort when there is such a positive way of taking care of it. Thanks to my doctor, I can enjoy my life and my family again.
We hope that this presentation has given you a better understanding of the detailed and caring process your surgeon and his staff has undertaken to provide you with the best care possible. If you have any additional questions, please contact your surgeon. We wish you continued improvement and good health.
Imagine backache so severe. Things like picking up your kids or tying your shoes. In tonight's health check, relief could be on the way with the help of a revolutionary treatment.
Be able to be physical again, you know.
And Dr. Theofilos' office is one of just 15 in the country which will conduct this study. Perfect candidates for the clinical trial are patients with severe back pain who have had no success with conservative therapy. For more information on the trial, you can call the Spine and Brain Center at 561-630-3870.
The South Florida Business Report, the only show in South Florida devoted exclusively to the local business community, is brought to you as a community service by the Fleet family of financial services, Quick and Riley, Fleet Private Bank, and Fleet Bank. Now, here's all the local business news from the lemonade stand to the boardroom.
Good morning, everyone. I'm David Weir, and thanks for joining us. Coming up next, one of South Florida's top neurosurgeons, Dr. Charles Theofilos, who's been selected to research a national groundbreaking artificial disc study. And in an interview taped earlier, I asked Dr. Theofilos what the innovative treatment was all about.
Well, we were lucky enough chosen out of one of 15 sites in the country to hold one of the artificial disc FDA studies here in West Palm Beach.
And what is that? Is that under the auspices of the FDA or anything like that?
It is. It's under the auspices of the FDA that we test patients who have low back pain and are candidates for having a spinal fusion. They're randomized into a study that 66% can get an artificial disc, which is, we feel, the wave of the future for patients with spine problems.
You're holding one in your hand. Show us how that works with this artificial disc thing.
Well,
you go ahead.
What the artificial disc does is that it replaces the disc itself, and it allows the spine to continue to have motion. In a fusion, you limit motion, and the spine becomes stiff. You increase stress to the levels above and below.
I got you.
But this, you're allowed to maintain your motion. So hopefully, you continue to have the same function and motion without the pain. Now the pain would be gone because the bad disc is gone.
Well, tell me exactly, how does this work for the patients? If I say, you know, Jesus, doc, I need this help, can I come to you and get involved in this program, or how's that work?
Anybody with low back pain who meets the study criteria, they come to the office, we screen them, they undergo certain tests to see if they're candidates. If they're candidates, then they are randomized into this trial. And as I said earlier, 66% will get the artificial disc. And then the other randomization will go with the traditional treatment, is the spinal fusion.
We're going to put up a phone number on the screen right now. It'll be your office phone number, and they can call that number and make an appointment to apply to get into the study, the FDA thing.
Yes, sir.
Okay, that's great. You know, a lot of times in my generation, you know, you don't want to cut on the spine. We just try to avoid it at all costs. How do you treat this type of situation?
Well, everyone's afraid to come to a spine surgeon because they think you have a knife in your hand and you're ready to operate. We treat conservatively over 90% of the people in our practice and can get by without surgery. What we've put together is a spine-specific rehabilitation program that I oversee.
I got you.
I have a hands-on physical therapist and a PTA, physical physician, and a therapist assistant. And what we do is we rebuild the spine for the patients. We enter them into this program, which takes about 4 to 6 weeks. And I have certain equipment that focus on rebuilding spine.
Is everybody different when it comes to spinal injuries and stuff?
Absolutely. Some patients are weaker than others in the spinal muscles, thus they're more prone to injury. And what we're trying to accomplish is get their muscles strong so it can protect the spine from any injury.
I got you. And with this new disc implant study that you're going to get involved with, that will eliminate spinal fusion operations. Is this correct? Is that what you're talking about?
Right now for the low back, and hopefully by December we'll have the neck ones also.
Oh, that's,
for the cervical spine, for people with cervical disc problems. This is going to hopefully, we believe in the future, take the place of most spinal fusion operations that are being performed today.
I got you. I know one thing. When you get a spinal fusion, you're just kind of walking around like a toy soldier, right?
Well, spinal fusion is great for the treatment of back pain right now. It's the best we have. So it's the gold standard. It's better than living in pain.
Yeah.
But we believe in the technology of spine that this is the next step up.
I got you. Good luck, Dr. Theofilos, one of the top spine guys in South Florida, on your FDA thing, and I hope this really works out for you.
Thank you, sir.
All righty. And stay with us. We'll be right back after these words. Wraps up this week's broadcast of the South Florida Business Report. Stop by next week for the only show in South Florida devoted exclusively to the local business community. Right here on News 12, the one to turn to for local business coverage. And for more information on our show or to review a story, check out our website at WPECnews12.com and click on the South Florida Business Report Programming Guide. Thanks for watching, everyone, and have a prosperous week ahead.
The South Florida Business Report, the only show in South Florida devoted exclusively to the local business community.
Coming up next, one of South Florida's top neurosurgeons, Charles Theofilos. Business Report producer David Weir asked the good doctor about the latest innovations in treating spinal diseases and other conditions.
Well, right now, the current move is, instead of doing fusions for the lumbar spine or eliminating the disc or eliminating motion, is an attempt to maintain motion of the spine. We feel that by maintaining motion in the spine, patients will have more motion as they get older. So the current technologies are artificial discs, total disc replacements, whether for the neck or the low back.
Right.
And that's where the current FDA studies are focusing on.
I got you. Well, you know, you're number one, you're the chief of neurosurgery at Palm Beach Gardens Hospital. Plus, you have the spine center in North Palm Beach. What's that all about with the spine center?
Well, what the spine center does, what we try to do is have a complete treatment package for a patient. So if a patient comes into us from a muscle ache to a completely disabled spine, we can offer them from MRI scans, physical therapy, rehab, injections, all the way to minimally invasive surgery, all the way up to rebuilding of the spine. So what we're trying to do is offer them a complete package run by a spine surgeon who, if we can help them with conservative measures, that's what we will do. But if it takes spine surgery, we can offer that also.
Well, spine surgery is pretty, you know, the general public thinks, oh my God, I don't want to get involved in any surgery on my back or spines and so forth. That's kind of like a last resort, or is it, there's a lot of other things that come before that?
Absolutely, you know what?
I know you don't want to go into surgery every time.
You know, we try to avoid it. We try to stay out of the patient's spine if we can. But if they have failed conservative measures, or they have progressive neurologic problems, or their pain is just unbearable and it's worsening, then there are techniques we can do, from minimally invasive techniques by shrinking the disc, to heating the back wall of the disc, all the way up to replacing the disc with an artificial joint.
I'm going to flash something up on the screen right now. And what do you do with this particular piece of...
Well, this is a current FDA trial that we're now engaged in. We're one of 25 sites in the country chosen to do this trial. And what this device is a chromium cobalt device that will allow the patient to get rid of the pain by having surgery to their neck, but replacing it with an artificial joint.
I got you.
This is randomized. Patients will be randomized against a fusion, which is right now is the gold standard. With a fusion, you lose motion.
Yeah.
With this device, you'll hopefully be able to maintain motion at that level, so you'll be able to use your neck like you did beforehand.
I got you. Well, when you do this type of operation, how long does it take for the patient to recoup?
Anywhere from 1 to 2 weeks up to 4 weeks.
And they're back in the ballgame.
You know, we have patients...
We can't play tennis, but we're going to walk around, right?
You know what? We have people playing pro football after having neck surgery.
Really?
Yeah, look at Alstead from the Bucks.
Yeah.
He had neck surgery. He's back the next season playing football. So people think that when you have spine surgery, you're going to be in a wheelchair the rest of your life. Well, that's not right. That's not true.
Yeah.
What we're trying to do is get you back to a functional life. We're trying to get you out of the wheelchair, trying to get you out of being in pain. We want to get you back to being a